It is my opinion that today's consumer doesn't want the product that exists in traditional senior living. It can have a stigma. It's something they had to deal with their parents. They don't see themselves in that way, even if they need assistance with daily living. Senior housing is an industry we're really at a pivotal transformation point, in my opinion, on what is our identity going to be. My belief is that active adult with preventive healthcare services and adding on services to help residents age in place is the answer to that, because it is a more active lifestyle. So senior housing has definitely been hurt some by utilization rates and that average age increasing at move-in.
If you or someone you know owns an apartment community, listen up. Storyboard Living is actively seeking 40 to 250 unit apartment communities within a 3-hour drive of St. Louis, whether that's Carbondale, Illinois, Columbia, Missouri, or St. Louis County. We're easy to work with and competitive on pricing. You can send information to deals@storyboardliving.com. That's deals@storyboardliving.com. Laurie, thanks for the time. I really appreciate it. You're the co-founder of Avenue, a company that's focused on development, construction, and investment. You're building around aging demographics and the gap between multifamily and traditional senior living. You've developed just under 4,000 units, which encompasses roughly $1.5 billion in healthcare, senior housing, and apartments. I'm excited to jump into the conversation. I think it'd be great to first hear kind of how you grew up and maybe your first introduction to real estate or entrepreneurship.
So I grew up here in St. Louis, over in Baldwin. Both of my parents are CPAs, very detailed oriented, extremely risk adverse. And so the fact that I got into commercial real estate, even this many years later, still gives them a heart attack sometimes with the amount of risk that I take. But I had no idea what real estate was. I had never grown up around it. My parents' friends weren't in the business. I really got lucky because when I went to Butler University in Indianapolis, I ended up being a part of their business program and majoring in marketing, even though originally I was going to major in dance. So that was a fun switch and ended up being good for the long term. But Butler requires 2 internships for graduation. I really love statistics and math, get that from my parents. And so I was doing marketing research, analytic heavy internship in Washington, D.C. at the time. And I was working for a very small company there that was doing consumer research for like AT&T, Martha Stewart companies. Interestingly enough, this is a side part of the story, but interesting. The woman I was working for at this small company was trying to get into political polling and away from consumer marketing research. The woman that owned the company, she doesn't anymore, but it ended up was Kellyanne Conway, Trump's advisor from the first campaign that he had. So none of that was part of my internship, but always just an interesting story of the people that you meet in life. So I was living in DC at the time, and I was not able, because I was a poor college kid and there was an unpaid internship I was doing there. I wasn't able to get back to St. Louis or Indy or Chicago to interview for a second internship. So by the time I got back, and I was the summer before my senior year of college, there was one company basically that was looking for an intern, and they had applied late for the program. And it ended up being an apartment development, property management, and construction company called Edward Rose. And they had a division in Indianapolis, and they were looking for a summer market analyst intern. And that's where I started and fell in love with the business from there.
That's a very interesting story. So it happened very organically by the sound of it. How did you go from, or when did you go from making the switch of working at a firm to co-founding your own firm?
Well, I would say 2 things to that. I think a lot of people who are entrepreneurs have the entrepreneurial bug very early on, but it takes a while to develop what that is and how that can be monetized into a business. So even when I was little, I can always think, of times. My mom is not at a corporate CPA. She actually runs her own tax business still to this day. And even when I was little, when my mom went off on her own, I remember thinking of ways, and I was like 8, of how she could run her business more efficiently, how we could, like early on, like CRM systems, right? And so that was, for some reason, like always ingrained in me on entrepreneurship. And as I got through my career and I was working for other real estate development companies, whether that was in the apartments or healthcare or senior living, I was always thinking in the background, what could be different? How would I do this if this was my own company? And back in 2012, I met my co-founder, Mike Mattingly. He was working at a large general contracting firm in central Indiana. And that GC, I was hiring at the development company I was at the time. And we were taking both firms out of Indiana, out of state for the first time into Colorado. So Mike and I were traveling a lot together. And we thought, well, if we were doing development and construction and senior living, what would be our niche on it? And I think, like anything, if you know too much, you'll never do it. And thankfully, we were 30 and 32 at the time, and we were young and naive, and we jumped ship. Really, I mean, in hindsight, not knowing as much about the business as we should have, starting a development company. And we've learned through the school of hard knocks throughout the way.
Just to confirm, at that time, the development you were working on, was that a senior living development or just like market rate multifamily?
Oh, so when I met my business partner, Mike, I was doing senior living at the time. So I went from doing the apartments for the summer internship in college. And then after that internship was complete, I worked throughout my senior year of college for them. And then fast forward to that, when I graduated from Butler, I got an opportunity to get in the healthcare space. And so there was a large developer called Loth Property Group in Indianapolis that was starting a healthcare division. And I was one of the first 4 people to start that healthcare division and working with hospital systems throughout the country on where they should place their ambulatory care locations outside of the main hospital campus. So I did that for several years, and that was a lot of fun, traveling around the country, meeting a lot of different people at such a young age, and really learning about the healthcare business. That might be important later in our conversation on healthcare. I did a small stint in industrial, like 75 days with some friends, and realized industrial was not what I loved. And then had an opportunity from a prior colleague at Loth who called, that was working at a skilled nursing development company. And he said, hey, we're really wanting to look to expand our development and really get outside of Indiana. Would you be interested on coming on board and helping us expand this platform nationally? And so that was in 2012 when I really got into senior living for the first time.
At that time, like in your industry, were a lot of folks talking about some of the changes in demographics and some of the even the phrases we use today. As someone who's not in senior housing, you know, I'm very well versed in the phrase "the silver tsunami."
That's right, gray wave, silver tsunami. Yes.
So were folks talking about that in 2012, 2013 as well, or were you kind of on the forefront of a lot of what we're seeing today?
No, people were definitely talking about it. I mean, it's math. You see, as the boomer generation is aging and that tsunami coming, the bar chart gets higher and higher. I think what surprised people was that prior generations were utilizing senior housing at a younger age than they are now. So while we saw this cohort aging into what we thought would be ripe for senior housing, it's actually taken longer for the boomers to get into this bracket because people are healthier longer, right? They're aging better, quite frankly. And so they're moving in at a higher age bracket than the previous generations.
Not to go too off topic just yet, but do you think tech, like in the form of life safety devices or other things, can help people age in place longer before they go into senior living communities?
Yeah, absolutely. And it's, in my opinion, the number one competitor to the senior living industry is not our actual competitors amongst ourselves, but it's the home. It's how do we compete with staying in the home and the resources that are available now through tech. Absolutely.
Got it. So going back to when you co-founded Avenue, what was the first project, or what did the early days really look like for you?
Well, the early days had nothing to do with senior living. We really got our start at Avenue in the healthcare space, in medical office buildings. And I was fortunate enough that someone that I know in Indianapolis introduced me to the co-founders of Oak Street Health, which is now owned by CVS. But this was in the early days. And so they are medical clinics that are geared towards seniors who might not have, or at the time would not have a specific primary care physician, and those seniors that were utilizing a lot of ERs for primary care services, and that were in populations that might not have access to healthcare in a lot of these neighborhoods. And so Oak Street was really advanced in taking those residents, those patients who are really high cost spend on the healthcare ecosystem, and helping them get on a prevention model to lower their cost of care for insurance payers. And so we were really fortunate to meet them early on. They had a couple projects, clinics in the Chicago area. And they asked me, would you be interested in helping us create a national platform for our real estate so we can do what we do, deliver quality care to seniors, and you could help us figure out that real estate. And so we worked with them for 2 years to create that platform before they eventually brought it in-house and developed. We've since developed about 25 of those similar medical office buildings, but we did about 13 for Oak Street in the first 2 years of Avenue. And that's really how we got our start, and really how we learned a lot about specific healthcare needs for seniors before incorporating that into a living environment.
Generally speaking, or if you're able to share details, what does that look like for you if you have a partnership with a company like that? Like, are you an equity partner in the buildings? Are you strictly earning a fee? Are you able to, shed some light on that?
Sure. We've done lots of different scenarios with clients that way. At the time, Oak Street was more of an early stage startup. They clearly are not anymore, but a lot of the clients that we've had really word from mouth in this are earlier stage, seed stage, Series A, Series B firms that are working with private equity to start their clinical business. And there's nothing about the bricks and mortar that's in that business plan. And so we will typically develop everything for them and own the real estate and do a lease back to them, so that they can keep everything off their balance sheet and focus on their clinical delivery. We've also done some work that's been fee for service, that the client may want to own a location but does not know how to take it through the entitlement process, designing throughout the entire development, and we'll do that for a fee.
Got it. So in like the Oak Street situation, for example, would you have negotiated all of the lease terms prior to construction, or was it dependent on maybe fluctuations in your construction costs and things like that?
No, everything would be before. So we want to know, both for us and for them as a client, capital preservation for my clients is incredibly important because, again, they've raised money from investors for clinical delivery, and the piece that they're doing in their physical plant has to be very well calculated because that is how they expand. And so they need to know what their cost is with me so that they can extrapolate that into how do we grow into 20 locations. That's very important for their business model. So we go through a series of iterations of early pro forma, middle stage, and then finally right before construction when we have hard cost bids that we're going through those budget iterations. So we'll sign a lease, we'll create a final budget with them, we'll put in contingency in that budget because nothing is perfect in construction, but we have to stay within a very tight range before we even break ground.
Got it. And I'm sure on the debt side, that would have been a requirement of some sort as well, right? Having the lease in place.
Absolutely.
Got it. So from that point forward, how did the company start to evolve and become what it is today in terms of you having development, construction, and investment, all under one umbrella?
By kicking and screaming. how we got there. There's been no stage of this that I think I've totally accepted with open arms, even though I'm an entrepreneur. A lot of it almost felt like expansion because we had to be honest with you. So when we got out of medical office and we started getting back into senior living, it was really a lot of our past clients or people we knew in the industry calling us and saying, "Hey, are you gonna get back into senior living? Because we really need help." And it was very humbling, and also a stage, again, quite frankly, that doing a project of that scale, these medical buildings that I'm talking about were between 5 and 15,000 square feet, versus if you're looking at a senior living building, you're talking about 90,000 square feet up to 250 for active adult apartments that we'll talk about. And so these are very large projects. And so we got in it incrementally. We did a lot of joint ventures with operating partners. So when you think of a traditional senior living building that has nursing staff in it, we call that assisted living, memory care, independent living sometimes. Those operators that manage like day to day, they're hiring that staff, right? They're hiring the culinary team, figuring out the activities for those residents. So we'll partner on a joint venture with that operator for both the real estate and the day-to-day operations in that business. Again, we know the real estate, we're going to deliver that to them and do what we do, and then they deliver care to the seniors day to day on the operations business, and we're all going to work together and share in that. And so we did that for about 8 years, and we're still doing that to this day, although on a more limited basis than we were doing a few years ago because our business model has changed, which we'll talk about. But that's really how we went from medical to senior. And we are still doing some of the medical work. We do about 1 to 3 projects. Again, from those startup companies, we get calls from groups that have left and gone to a new startup, and they call us and say, "Hey, will you repeat the model?" And so that's been fun to work with the same friends over a decade.
When you're looking at a medical deal or a senior deal, what are you reviewing in terms of like, are you looking for specific demographics, just in your site selection criteria? What does that look like for either one?
So I'm going to break that into 3 segments, and maybe that's a way to kind of talk about what our new business is too. For a medical deal that is very client driven, each of our clients in the medical space, we typically are working with clients that are still doing some type of care delivery for seniors on the medical side. So whether it's general primary care for seniors like Oak Street Health, or we work with a group that called Herself Health up in Minnesota that's focused on primary care for women that are older. We focused for groups in different geographies for seniors. And so it all has this age-restricted focus, and that is going to be determined about where that client wants to be. Very demographically driven down to really the street. I mean, the market analysis that we can do now with a lot of the healthcare spend data that's available is extremely granular. Then I'll go into senior housing. That's really changed in the last decade too. As I mentioned, the resident is getting older that's moving in. When I started in this business, we were looking that the average age of move-in was around 80. And now it's really the mid-80s.
Wow.
Yes, it's changed dramatically in the last decade. And so we look at a combination of factors. Where is the potential resident living? Where is there a high concentration of seniors? But where are the adult children? Because that is an important factor. And we see a lot of older adults also moving to be closer to their adult children. So we'll look at adult children. We'll look at, to some degree, with our new product type, we'll look at grandkids and what patterns of school systems are growing, et cetera. Discretionary spending and really healthcare spend. Where are there areas that Medicare spending might be really high or low, depending on what demographic that we're targeting. We'll look at all of that data when we're doing site selection.
Is this data coming from multiple sources?
Yes.
Okay.
Lots of sources.
Okay.
And sometimes our capital partners have sources that they want to use too.
Okay. Got it. Do you think AI can help or is maybe already helping you with scraping data and maybe helping formulate some of these
Oh
decisions?
yeah. And even and I'm sure you're seeing this. I mean, it's changing weekly in what we can do with it. Um, AI has definitely helped us in doing more concrete budgets early on. We can get much more focused on a budget with what kind of property taxes and fee structures for municipalities. We're really able to hone in on those specifics without spending a lot of time calling or, quite frankly, hiring a third party to do a study for us that we're having to pay for. AI can do a lot of that now. It's even going into design with architecture, but also site engineering. There's programs now that we're using to do a site fit plan for us that will read the municipal codes and know what type of setbacks we need in an area. We'll even understand, could we have like wetlands? They'll compile all of that into the map form, and then we can input how many units we want. What's the unit mix? It will look at what our typical architectural plans are for unit sizes, et cetera, and lay out a site plan for us that then we can go give to the civil engineer and the architect to start with. And that saves thousands of dollars from our development budget.
That's incredible. And like you said, it's really is evolving every couple months, every couple weeks. It's incredible and very exciting to see where some of this technology takes us and how efficient it can make us.
Yeah. And we're seeing it everywhere in development, even on the brokerage side. You were talking about site selection. We were playing with, can we almost create like a mini development company within like Chat GPT? And how can we help our land acquisition team find more sites without them having to travel as much? And it's amazing when you put in parameters and sites that it can comb all the different brokerage websites and even the municipal like property tax records for sites that might be unlisted that fit criteria that then you could go cold call that landowner.
That's a great tip. I actually might start
Yeah.
implementing that. So you kind of alluded to the newer part of your business. If you can give the background on why you launched a new vertical and maybe the thesis around what you're doing there.
Sure. This is kind of going to bring everything we've talked about together. So the summary is our new business model going forward and what we're most focused on outside of medical at Avenue is what we call active adult living. And our brand is called Viva Bene, which means live well in Italian. Active adult is age-restricted apartment communities that are focused on lifestyle for seniors. So in a traditional multifamily, you're going to have multi-generation living, but the activities might not be there. The socialization of like-minded residents might not be there. Active adult was really created a decade ago to have that stepping stone, like you were saying, between multifamily and senior living. These are for residents that don't need assistance with daily living. They don't need healthcare, but they want to be around like-minded people that they can socialize with, and maybe they might be tired of taking care of the maintenance of their home as well. And so that's the thesis of active adult in general. How Avenue is looking at it, we took all the work that we did with our medical clients for the last decade, and we said, hey, there's something here. All of our clients are focused on preventive health for seniors and how we can keep them well in their community longer, keep them at home longer in a lower cost setting. What if there's a way to marry that of the socialization and active lifestyle that is part of an age-restricted active adult apartment community, and we can marry that with these preventive health principles that our clients are doing on the clinical side? And that's really 6 years ago how Viva Bene was born. We've had some iterations with that, but our first project actually opened in the St. Louis Metro over in St. Peter's, January of last year, of 2025. And we are partnering with several different healthcare and health and wellness delivery models to bring preventive health services to our residents that is billed directly through their insurance and is not an additional cost on their rent. So let me tell you what that means. We have primary care services. We have care coordination, which is just a fancy word for medical concierge. So if you live in our community and you had to go see a cardiac specialist, but you have questions after that, you have to do some follow-up appointments, you're not quite sure of some of the medication that they suggested, how it will interact with your other medication, you can call up our partner at Sevi Health and ask all these questions. And they will be kind of a conduit for you between your primary care doctor, your specialist, and your own questions to give you a very personalized experience to navigate this healthcare ecosystem. We're also partnering with a group called Groove Health that's doing AI-powered strength and mobility training. Really helps our residents, especially who are female, on osteoporosis and prevention or delaying some of the onset of those symptoms. And so we're really trying to gain the spectrum of health and wellness in a holistic way for our residents so they can live a longer life in the comfort of their home, which for us is in Viva Bene.
That's awesome. That sounds very exciting. When you were deciding on the first location for Viva Bene, a Viva Bene community, how did you land on St. Louis versus one of the other markets that you've operated in and are operating in?
Yeah, it was really important. Obviously, the first of anything, you're going to be scrutinized. It's a pilot. There's a lot of, because we were the first in the country to add these preventive healthcare services and not just an active adult community. We wanted to make sure that we could hit certain metrics. One, St. Louis is we both know and love, is an amazing community. But people can be opinionated here, right? We have a long history. There's a lot of legacy here in this metro area. And we wanted residents that weren't afraid to be the first. We wanted residents that wanted to be part of these pilot programs, that wanted to give us really honest feedback about what we were doing so we could change it and make it better. And I knew growing up here, because when we started Viva Bene in St. Peter's, I was not living back here at the time. So I knew that this would be a great spot just from a resident profile standpoint. We also wanted to work with municipalities that were open to this type of living environment. When you go into zone, there's not a active adult zoning code. So a municipality doesn't know if they're going to put you in multifamily in a senior housing category. And so we wanted to work with a city that was really flexible in that zoning. And St. Peter's was wonderful working through us with that entire process.
Where did you land on the zoning?
We are in, it's a great question. I think we're in a multifamily commercial district.
Okay. Just curious, because I know St. Charles County is now talking about, or maybe they've already placed a temporary hold on new apartments. So I was just curious if you'd.
And we see that a lot. Yes. Like Ohio. Ohio has a huge demand. And that was the third thing, sorry, that I was going to say about St. Louis. There was no active adult on the Missouri side of the metro area at the time. And still today, we are the first ones open. There's another project being built over in St. Charles County. But so we were pioneers in that. But we see that a lot. Ohio is a state that has tremendous opportunity for active adult. But there are a lot of restrictions against multifamily right now. It really has a negative connotation.
Mm-hmm. And I think the beneficial thing of what you're doing for a lot of the municipalities is one of their concerns would be the burden on schools. And
right.
I would imagine there are no children living in a Viva Bene community because it's active living.
Right. We do have restrictions. Somebody could live there. That's not to say that if you're an adult child and you have a child and the grandchild needs to stay for a little while, or they want to spend the weekend with grandma, that's not to say that they can't do that. But the primary resident absolutely has to be in that age restriction.
Did you face any hurdles, in terms of lenders or investors not understanding what you're trying to do? Or were you able to just effectively paint the picture and everyone was on board day one?
Yeah, we've been really fortunate with our lender community, and we work with a handful of lenders that have been with us for a long time at Avenue. But I think because this is such a concept that's personal for all of us, many of us have had family members that have looked at senior living or maybe thought, hey, my mom or dad probably needs to move out of the house because their friends don't live in the neighborhood anymore, and they're quite frankly just lonely. And there hasn't been a solution to that because they're too young, too healthy to go into a traditional senior living environment. And so what do they do? And I think this is such a personal story for so many of us that a lot of our lending partners, it resonated with them, and they fully understood it.
That makes a lot of sense. And it made me think of there's another apartment community in town. It's like a really nice Class A apartment community. And a lot of folks that moved into it were downsizing, selling their houses, not wanting to have the hassle of home ownership. But then one of the complaints that I've heard is it could be too loud, or like, it can be all these other things because there's a wide range of people living there. So your community in St. Peter's is really based on giving people that option if they want to downsize or whatever else, but then letting them be around people of a similar age.
That's
and
right.
Then you're creating a community and lifestyle focused on putting health first.
That's exactly right. Yeah.
Okay.
Well said. Almost better than I said it. Thank you.
No, I appreciate it. There's another concept in the country. You may have seen it. It's called lifetime living, lifetime fitness apartments, basically.
Yes.
They look wonderful. I haven't been to one, but are you doing essentially like a lifetime living for the 55 plus crowd?
Yeah, that's such a good question because I think a lot of times when potential residents come in, they hear health and wellness and they think fitness, right? Or fitness forward. Maybe I'll say it like that because I think lifetime living is very like fitness forward,
Yep.
nutrition forward. Those things are absolutely important to the aging process, but it's more than that of what we're doing at Viva Bene. It's like you said, that sense of socialization. Depression and anxiety is incredibly prevalent in this age cohort. And so one thing in this community lifestyle focused environment, it reduces depression and anxiety because you're not isolated anymore. It's also focused on different seminars, lifelong education. So we bring in different activities that are both resident-led and through our activities director. And that can be different at each location. But maybe the residents want to reduce anxiety and bring in a meditation class. Maybe they want to learn, they want to eat healthy, but they don't want to be boring. So we can bring in a chef to do personalized cooking classes. Maybe it is around like fitness, but it really is that holistic approach that is not as fitness forward as some of our residents are afraid that it may be.
Sure. Yeah, that makes a lot of sense. And it's all very important. So for this pilot project to be considered a success, what metrics are you looking at? And then when or how will you decide to, build a second, third, fourth?
Oh, well, we have decided to move forward on more for sure. So one of the early success was, will there be demand for this? As the first in the Missouri side, as I said, you can put all the kinds of numbers on the paper, but until you open that door and move and start, you never really know. We had incredibly strong pre-leasing in this. We started pre-leasing about a year before we opened because we really wanted to get that education piece out to the market about first, what is active adult since it was new? And then what is the framework around what we call this holistic approach to health? We've branded Well VB. And how is Well VB helping you live a longer, healthier lifestyle in the comfort of your home and helping your adult children take off some of that burden too. So we had about 35% pre-leasing before we opened in January of 25. We opened 14 months ago, and we're 82% leased already. So we have a track record to be one of the fastest active adult in the country to lease up. And so with that, those early KPIs, we absolutely are taking a bet on ourselves and expanding this to other states. We're under construction on the north side of Indianapolis in Carmel, Indiana right now. We're definitely looking at more sites and active discussions with landowners around the St. Louis area to expand, and would love to have up to 3 communities here and in other states around the Midwest and Mid-Atlantic.
So would you want to stay in the Midwest and Mid-Atlantic long-term as well? Or would you ever look at, coastal location or anything like that. I'm just curious because I feel like anyone that I know of that's operating in multiple states, if they're in the Midwest, they kind of stay in the Midwest. It's hard to bounce around, if that makes
Yeah.
sense.
Well, I think in development and construction is local, as you know. But I think there is a way to expand the concept of Viva Bene. So yes, as Avenue, we want to focus where we can bring the most value for the local residents and our investment partners and lending partners as we can. And that's going to be where we have localized connections for our construction company, for the activities for our residents, for the healthcare partners that are coming in so we can deliver that extra value to our residents. We're going to stay in that focus. There's also a lot less competition in active adult and a lot of markets like St. Louis that don't have these communities that we want to bring it to. But what we are looking at is expanding that, what I said, the Well VB, so that health and wellness programming, our healthcare partnerships with Sevi and Groove and the fitness and the education classes, that Well VB holistic package, we are looking to partner with other owners and developers so that they can take that same concept and put that in their communities that may be outside the Midwest and Mid-Atlantic.
Got it. And that would that look like a monthly subscription cost, or like what would that look like for those developers?
It could be a one-time setup fee. There's also some like really detailed healthcare nuances with our healthcare partners that work on what we call like value-based care. And in the medical world, that is when you're delivering better quality care at a lower cost than a lot of competitors. And so there's really detailed programs set up with health insurance payers around Medicare and Medicare Advantage plans that give savings on that. And there's different ways you can slice the pie with your medical partners to share in that savings.
Are you typically setting up deals deal by deal with this new concept in terms of putting together your debt and equity, or is it some sort of joint venture or fund?
We are really doing the Viva Bene expansion programmatically. Our medical and our senior living deals are typically deal by deal. And a lot of our medical, we've been very fortunate to do friends and family because of the success that we've had in track record in that industry. But on Viva Bene specifically, we are scaling with a capital partner, and we've raised an internal fund on the general partnership, the GP side, for expansion for the first 5 locations. And probably early next year, we'll start on Fund 2 for that.
That's really exciting. And I have to ask you while you're here, I'm not in senior living. As you know, I'm in the apartment space, but I've heard from other people that maybe the last couple of years have not been great for senior living as a whole. I think there's been maybe, I don't know what it is, if it's overdevelopment or maybe just construction costs and rates and, insurance and all that. Can you shed any light on just senior living as a whole and what the landscape has looked like maybe the last year or two?
Yeah. So great timing. I actually yesterday just came back from our second annual large industry conference, NIC. And since COVID, it has definitely been a challenge in senior living. We started this conversation talking about the Great Wave, Silver Tsunami, all of the demand that is out there. But one, and I'm going to be very honest with this, it is my opinion that today's consumer doesn't want the product that exists in traditional senior living. It can have a stigma. It's something they had to deal with their parents. They don't see themselves in that way, even if they need assistance with daily living. And so senior housing is an industry we're really at a pivotal transformation point, in my opinion, on what is our identity going to be. My belief is that active adult with preventive healthcare services and adding on services to help residents age in place is the answer to that, because it is a more active lifestyle. So senior housing has definitely been hurt some by utilization rates and that average age increasing and move-in. Staffing, I think like any industry, right? We saw the news that yesterday that healthcare employment has been a shining like star in the economy, but it is for various positions that might not be high wage. And so we definitely have that in senior housing. And because of that, there's a lot of competition for labor in senior housing that they can go across the street or in another healthcare adjacent industry for $1 more an hour, and that's obviously enticing. And so we've seen real operational expense pressures and operating margins that have compressed because of that in the industry over the last few years.
Got it. That's really interesting. Just going back to the active living, the physical product itself, how does it differ from market rate apartments or from senior living? Like, are there certain design elements or even the heights of vanities and things like that
Sure.
that differ?
Sure. I would say and would love anyone to come out to St. Peter's and take a look. It looks like a traditional Class A luxury multifamily community when you're touring. We follow fair housing and ADA design requirements, just like multifamily does. What might be a little bit different, it's not in the finishes of the units or the amenity spaces. It might be some of the sizes of the units and the types of amenity space and where they are in the building. So we wanted to be very thoughtful to have those gathering spaces to create socialization for our residents. And one of the things that we actually did in St. Peter's that we're doing differently in Carmel, Indiana, is we made the main gathering space too small. I mean, our residents are really interested in the community-wide events, and when everyone is there, it feels a little cramped. So we've made that larger. We also wanted to take that WellVB activation space, so our fitness center, yoga room, the healthcare clinic, the multi-use room where we have seminars and cooking demonstrations, that's all in one hub. So it doesn't feel like if you don't want to work out today in the fitness center, like that's okay. Because some of the other activities that you're doing are in that area and you're going to go and you're going to see that daily, that some of that is geared towards you and you might feel more comfortable seeing it before you actually utilize it. Same thing with cooking. You think you were a bad chef growing as you were raising your family and you don't want to cook anymore. Well, maybe if you come to the classes and see that it is fun and easier to create healthy meals than you thought it was, that'll help engage you. So we put that all in one area. Our units are a little larger than multifamily too. We do not do studios. 40 to 60% of our residents are moving from a single family home that they've probably lived in 20, 30 years. And so that's a lot of downsizing, a lot of things. We really wanted to be careful in the design of our units to make sure that they are a little bit larger than multifamily and that we have additional storage spaces in the building for residents to use.
Do you think with people downsizing and, at that stage of their life, I'm sure they have a lot of physical possessions. Do you think there's a need for self-storage to be located close by? Not just a storage on site, but maybe like a storage facility?
Yeah, that's a great idea. Maybe we should co-locate those. Yes.
I'd want to be close to my stuff, so that's why I ask.
Right. Yeah, new business line. WellVB includes storage. Yeah. Honestly, we've never thought about that, and I think site selection has become so much harder, and the availability of developable ground that can be entitled has become so difficult in this last decade that we aren't always able to co-locate near there. But I love that idea.
Do you have any challenges today when it comes to construction, whether it's sourcing materials, rising costs, or is that more or less behind us?
I think it is forever going to be a challenge now that, again, we're going to go back to this boomer generation. That is the leadership in the construction industry, and they're aging out. Our superintendents, our foremen, a lot of them came from that generation, and we don't have enough people entering the trades to backfill that. And so even though some of the material pressures that we saw in the last few years since COVID, that subsided, labor cost is still up, and in my opinion, will continue to stay elevated until we are able to have technology take over more of that construction process. And again, in my opinion, that's decades away.
Are you using like any sort of modular construction at all, or is that not does that not save enough time or cost at this point?
We've looked at doing modular and paneling like pieces. Like you can prefab some plumbing and some like electrical in a warehouse and like ship it. But as far as doing large scale modular, it really is a transportation logistics issue. And are you near that manufacturing area? Because it's so expensive to transport that if you're a certain distance away, it doesn't make sense. But we have looked at doing smaller components in warehouses.
Got it. You're working on a lot of exciting stuff. I want to be respectful of your time. So I'll ask you one last question. In your role, in your seat today, what's your day-to-day look like? I'm sure in the beginning you were wearing like a million different hats and you were running all over the place building a business. But today, what do you do more or less on a daily basis?
I'm sure you hear this from all of your guests. No 2 days the same.
I get that.
I'll give you the real day-to-day, like CEO type answer of honesty, and then the pie in the sky, what we all want to do and what I carve out time to do as well on the strategy side. Problem solving. I mean, my day-to-day is about what is the fire of the moment, what is the problem, and that can be anywhere from a development issue, construction problem that we've had while we're on site, or operationally with our operating partners and something that's happening like in the building. So definitely day-to-day problem solving. Second is strategy. I have really high goals for Viva Bene that we can prove out in the healthcare model that this living environment allows residents to age in place healthier, longer, and to reduce cost in the healthcare system. And so a lot of what I'm working with my healthcare partners and different consultants for a long-term strategy is different ways to maybe subsidize, include, maybe with a lofty goal with CMS one day, that rent could be part of a supplemental benefit on a Medicare Advantage plan, because we're going to prove out that this type of living environment keeps people happier, healthier, longer than a different living setting.
That's incredible. I mean, I can feel the passion you have for your mission, and I love what you're doing. I do want to come visit and see it in person. Where can people learn more about you and your company?
There's lots of ways. My marketing team is amazing. We're on Instagram, we're on LinkedIn, we're on Facebook. Our website is avenuedev.com, and you can always reach out to me, Laurie Schultz with Avenue on LinkedIn, and I'd be happy to connect.
Yeah, thanks a lot, Laurie. Appreciate it.
Thank you.